welcome back to my channel. Do you know you do not need rocket science to figure out the illnesses going wrong with your body by just looking at your face? Some of the illnesses in your body would also reflect on your face, and this is just the body's way of tipping you off that something is going wrong on the inside. But most times we miss this because we do not understand what to look out for. In today's video, I'll be enlightening you on what your face has to say about the status of your health. Watch you to the end of this video to learn all the signs you can tell about illnesses going wrong with your body by just looking at your face. If you're new to this channel, my name is Dr. Ogo and you're most definitely welcome. I hope you stick around and join our growing community by hitting the subscribe button. Also remember to put on a notification bell so you're notified whenever I post new content. And if you're a returning subscriber, thank you so much for supporting what I do. I really do appreciate. So let's go straight into this topic for today. Number 1, yellowness of the eyes. This occurs due to toxic buildup of waste products when your red blood cells are broken down. Now, the red blood cells are part of your body cells and their function is to carry oxygen from the blood to the tissues for metabolism. When these red blood cells are broken down, they produce a yellow pigment. Ideally, these yellow pigments do not cause any problem. But problem arises when there is excess production of this yellow pigment or is not being excreted as it should. If there's excess production as to when these red blood cells are broken down excessively, there is too much than the liver can excrete, or if the liver is having a problem and is not able to excrete it, then problem now arises. In newborn babies, this can occur because their liver is not well developed, and while they are inside the mother's womb, the mother helps them to clear this yellow pigment through the placenta, and when they are born, their liver is not yet mature to actually handle this yellow pigment, and they can temporarily have an increase in this yellow pigment. In adults, it usually occurs when there is injury to the liver. This can occur in certain situations, like when someone has hepatitis, which is an infection of the liver, or when someone abuses alcohol that it injures the liver and impairs this function. This will all lead to increase in yellowness of the eye. Number 2, moles. Moles are spots or bumps that are dark in color seen on the face. These are otherwise harmless and they would usually cause no health problem, but paying close attention to them would help you recognize when they're becoming cancerous. And some of the features to know when they're becoming cancerous include when there's a sudden change in shape from what it used to be, or the borders become rough, or it start developing different colors, or you notice that it's getting bigger, or you notice a sudden change within a space of weeks. These are all indications that this is about becoming cancerous and you need to see your doctor as soon as possible. Number 3, sores. Those sores usually develop around the lips and mouth, and this is caused by the herpes virus. Most individuals who would develop this would have been exposed as children, and during that time they would have had the sores on their lips and mouth and it will regress. But then subsequently in life, with exposure to sun, when they get sick or they become excessively tired, this will reoccur again, giving them the same kind of sores on their lips and mouth. This is usually nothing to worry about, as it will usually go out on its own without any treatment. But if you notice that you're having this more frequently, or you're noticing that it's getting bigger, you need to see a doctor to prescribe a medication. Number 4, cracked lip. It can be normal to develop cracked lip when you're in a dry weather, but then having a cracked lip could be an indication that your body is not getting enough water, and this is your body's way of trying to tell you to take in more water, so your cells will have a lot of water to perform its cellular functions. Number 5, butterfly rash. Most rash on your skin would usually resolve spontaneously without any treatment, but this particular rash is unique in that it develops over the 2 cheeks, giving you a butterfly shape. And this occurs because your body is fighting against its own cell, a condition known as lupus. There will also be other accompanying features to watch out for, things like joint aches, fever, or your fingers turning blue or white during cold weather. If you notice any of this at any point, you need to see your doctor to make a proper diagnosis and start you on treatment as soon as possible. Number 6, hair in unusual places. As we get older, we may begin to develop hair in unusual places, such as the ears and the eyebrows for the men and the chin for the ladies. However, in younger women, having facial hair could be an indication of a syndrome known as polycystic ovarian syndrome. In this condition, there is failure of the eggs in the ovary to mature, and therefore no egg is released during ovulation. these women will find it difficult getting pregnant. In addition, they will also have acne. So if you ever notice that you're having facial hairs, acne, or if you're married and you're finding it difficult to give birth, this could actually be a cause, and it's something worth exploring by going to see your doctor. Number 7, drooping eyelids. This can occur in one or both eyes, and sometimes they are usually harmless. However, it could actually be a sign of a problem with your brain, your nerves, or even the eye socket. So if you notice you're suddenly developing this, you should actually go to see your doctor to actually exclude other causes of drooping of eyelids. Number 8, inability to use a part of your face. If you ever notice that you're unable to use any part of your face, get help as soon as possible. This could mean that the nerve controlling the muscles of your face has been pressed on or is swollen. Presenting symptoms include jaw pain and pain at the back of the ears. This will usually resolve within a space of months, and it's usually not anything to worry about. There will not be other accompanying symptoms. However, if the accompanying symptom, this could be a sign of stroke. Stroke results because the blood flow to your brain has either burst or is obstructed. So whichever the case, there would also be other accompanying symptoms such as sudden inability to use your upper limbs and your lower limbs. You could also find that you're finding it difficult to speak, difficult to swallow, or even having double vision. Number 9, yellow spots on the eyelids. These yellow spots are made up of cholesterol, and they suggest a very high cholesterol content in the blood. This cholesterol can build up within your blood vessels and limit blood flow to your vital organs, especially the heart. When this occurs, you can develop heart attack any moment, and heart disease is the #1 killer in adults worldwide. So whenever you notice this, you need to see a doctor as soon as possible to keep those numbers in check. Number 10, puffy eyes. Puffy eyes results because the space between your eyes are filled with fluid. This can be caused by harmless conditions like lack of sleep, excess salt in your diet, or even with age. It can also be seen in certain harmful conditions like when the kidney is injured. The primary function of the kidney is to excrete waste product from the body and also excess water. So if the kidney is injured and is not able to perform this function, excess of this water builds up in the body, and you can see them under the eyes, the legs, and even the belly. Number 11, melasma. Melasma are grayish brown patches on the skin. The exact cause is not known, but is however thought to be triggered by pregnancy or use of birth control pills. And usually once you give birth or stop those pills, they will usually start regressing. Some might actually progress, and you may need to use things like chemical pills to get rid of them. It's also known as the mask of pregnancy. Number 12, hair loss. Hair loss on your eyelashes and eyebrows could mean that your body is fighting against its own hair follicles. Why a doctor cannot help you to prevent this, they can prescribe certain medication that can allow your hair grow back. So go see your doctor if you ever experience this. Number 13, bulging eyes. In some people, this is usually natural, but in some, it could actually be a sign of a disease condition. When it's a sign of a disease condition, other accompanying symptoms to watch out for include excessive eating, excessive sweating, anxiety, and even weight loss. I hope this video was quite helpful. Please go ahead and watch other of my videos, the early signs of diabetes to watch out for, and also my other videos on emergency contraception. Thank you so much for staying to the end of this video, and please subscribe to my channel. Until next time, see you.